close range. Okay. Which one is this specifically?
C2.
Yes, what's its proper name?
Axis.
Yeah. And how do you know that?
Let's get out Dante dens.
Yeah, it has the dens. Don't just say dens, say it has the dens, you know, something like that.
Absolutely.
So here it is, the dens or odontoid process. And that articulates here with the anterior arch of the atlas. And then when the head is rotated this way, the atlas is rotating around the dens. That's a rotary joint. And the head goes along for the ride. But this motion takes place predominantly between the occipital condyles and the superior articular facets of the atlas at the atlanto-occipital joint. Keep in mind that these things will turn up in Bio 10 also, but in section. So, in fact, I'm going to ask the occipital condyles and the superior articular facets of the atlas. They turn up in horizontal sections, you know, of the neck region. So you have to know it for Bio 10 as well. Okay, of course, what says that this is a cervical vertebra? Yeah, even these very specialized ones have transverse foramina. Okay, and then here's this business about the inflected spinous process, which is folded like this, with this being the superior or cranial side, and the side with the depression being the inferior or caudal. If you take a look at this, there's the crest on the superior side. Then if it's turned around, you'll see there's a fossa on the inferior side, and that's an axis exclusive. Okay. And then look for the usual thing. Now we're getting into vertebrae that are more typical. So look for the usual things. What are these? Those, yeah, the laminae. Okay. And by the way, once again, you should know the anterior and the posterior arches. The posterior arch is composed of laminae plus pedicles. Okay. Now, what is, don't say anything right away now. What is this one specifically? Don't say anything right away. What is this one specifically? Okay, go ahead.
C7.
That's not C7.
Oh.
I guess that's C6.
It's C6. Now, what says that it's C6?
It's because the largest.
Yeah, a large anterior tubercle. See, it's the only one with a large anterior tubercle. And this is only about 80% of it. When you look at this closely, unfortunately, there's no way of getting the little pieces to stay back on it in no certainty. You'll see spongy bone over there. The very tip broke off. So if it were intact, it would even be longer. But as it is, it looks big, you know, compared to what you see at the other levels. It's the only one with a large anterior tubercle. And then the common carotid artery contacts it laterally. So if the artery is severed superior to this level, you can trap it against the anterior tubercle and stop the blood flow. Now, this is a test legal question. Is there, now, don't answer right away, and remember the answer can be no. Is there anything aberrant about this vertebra? But don't answer right away, wait until everyone sees. Is there anything aberrant about this vertebra?
Define aberrant.
Second.
Define aberrant.
A deviant.
Oh.
Abnormal.
Doesn't have the spina bifida? Or, kind of.
Well, spina bifida would be out, why is that? Yeah, because there's a complete vertebral arch, in spina bifida. In embryology, when these develop, the pedicles appear first, and then from their distal ends, the laminae grow dorsomedially, toward the midline, and where the two laminae meet and fuse, the spinous process is generated. Okay? Well, so if you see full laminae, there's no opening back over here, there's no spina bifida. If there was spina bifida, there would be parts of laminae missing, and no spinous process. So that's out.
Has no anterior tubercle?
Well, it does have an anterior tubercle, that's how it can be identified as C6. There it is, right there.
Can you show me?
The anterior tubercle is right there.
Oh.
So what?
Okay, look at this. It's tilted obliquely, you see that? It's tilted obliquely. If it were normal, it would be in the median sagittal plane or very close to it. You see, it's tilted obliquely, you see that? That goes with scoliosis. It happens to go with scoliosis. Okay? That gives an oblique tilt.
That's a test legal question?
Yeah, it is. Okay.
I have it right here.
I'll forget to watch
Don't say anything right away. What is this one, but don't say anything right away.